be doing the assessing the client for the feeding. So, good day ma'am, I am the assigned nurse for you today and I'll be doing for you the feeding. May I know your name and your date of birth?
Cherry Credito, July.
Okay, thank you po. So, I'm going to proceed the process of the admin process. First is the assessment. I'm going to assess that GI tract is functional and determine what type of diet client can tolerance. I'm going to assess your abdomen. And next, I'm going to assess the client's ability to swallow and clients with neurological conditions assess the cranial nerves for 5, 7, 9, 10, and the gog reflex. I'm going to perform a hand hygiene and apply a clean gloves. Going to check the gog reflex information. Ma'am, can you see? Now I will determine to what extent the client to be able to self-feed, assess the physical motors levels of consciousness, visual acuity, and peripheral vision and mood. Ma'am, can you hold this? And now I'm going to assess the client's appetite, tolerance of food, and cultural and religious preferences and foods like and dislike. Ma'am, may I know your, do you have any religious or beliefs? Do you have any preferred food?
Mas prefer ko yung black.
Okay, thanks. So I'm going to proceed to the diagnosis. First is the risk for aspiration, risk for deficit fluid volume, feeding self-deficit, disturbed sensory perception or the gustatory, and impaired swallowing. And now we proceed to the planning. The expected outcomes following is the client denies any biting, chewing, or swallowing problem or food intolerances. Client's weight is maintained or changes according to the nutritional care plan. Client completes meals and client is able to participate in independent feeding. Next is preparing client's room for mealtime. So I'm going to clear the overbed table and I will set up a chair and and set up a chair for a client and a nurse and place the bed in upright back position if client is unable to be up in a chair. Certain conditions such as pressure ulcer, traction, or spinal surgery may prevent positioning with head elevated. And third is prepare clients for meal. Assess the client with elimination needs. Mom, do you want to go to the bathroom first before your meal? And next, I'm going to help the client for the hand hygiene. First is I'm going to help them to sit upright. Since my patient is sitting upright right now, I'm going to assess the hand hygiene for them. First is hand hygiene. Next is I'm going to assess the client with mouth care. Clients with dysphagia or dry mouth may benefit from clear water, rinsing, or spotting. First clients with stomatitis or the inflammation of oral mucosa may benefit from rinsing with a solution containing hydrogen peroxide, warm saline, sodium bicarbonate, or a combination of all agents. Next is consult with a physician regarding on oral analgesic. And next is help client to put in dentures and put on eyeglasses or insert the contact lenses. Check the dentures fit properly. And since my patient has a glasses, so next is I'm going to help the client to sit comfortably in the position of the client is unable to sit. Third clients on the side of the bed, and the head of the bed is elevated. Since my client is now sitting in the comfortable position, and next is I'm going to obtain the special devices and needed to supplies or to facilitate feeding the just like the two-handed cup with lead plate and the utensils with enlarge and utensils with splits and the towels. And next is for the implementation. Since I done performing hand hygiene and I wear clean gloves, I'm going to assess the tray for completeness. Just like opening the cover of the plate. So now I'm going to ask the clients for the preferences. Do you want your food to be seasoned or something?
Just make it blank.
Okay, thank you. So if the client is able to eat independently, I'm going to stop here and return after 10 to 20 minutes. For client who cannot eat independently, I will begin the offering assistance. Now, ma'am, you're going to eat this. So, ma'am, I will leave you for 10 to 20 minutes. Just press the call button if you need me. Next is for the client who cannot eat independently. I will begin offering the assistance. Do you want to help? You want to help me to for your feeding, mom? What do you prefer first?
Rice. Then fish.
So I'm going to ask the clients, since I already asked the clients about the cultural beliefs and the preference before, I'm going to ask if what the client would you like to eat the cut and food into the size pieces. Do you want to cut the fish, ma'am?
Yes, please cut the meat.
Next is, it may be helpful for the disoriented, visually impaired, or easily fatigued clients to have a food identified by location of the plate if the plate were enough. Ma'am, I'm going to assess you for your food. Your fruit is in the 6 o'clock and the fish is on the 9 o'clock and your rice is in the 12 o'clock. And next, 6 is feed the client in a manner that facilitates chewing and swallowing. First is for the older adult. We need to feed them for the small amount or assisting by biting, chewing, swallowing, and fatigue. For the neurological impaired clients naman, yes, we need to feed them a small amount also and assess the ability to chew, manipulate tongue, and to perform a bolus and swallowing. And give all small amount of thin liquids. And next is for the clients with cancer. We need to check for the food and advertise aversion before and during meals. And next is I'm going to provide the fluids as a required. Here's your and just sleep wait, okay, since I do not allow the patient to drink more, just a sip, and I already done talking to the patient, and this is now my opportunity to educate them. This meal, ma'am, can boost your diet and improve your healthy lifestyle. Okay. So after that, I'm going to assist the client with hand washing and performing a mouth care. After that, I'm going to return the tray for the appropriate place. And I'm going to perform a hand hygiene. And I'm going to help the patient to the resting position. Now that the patient is now in a comfortable way, and I'm going to proceed to the evaluation. First is observe the client's ability to swallow, weight client's daily if nutrition has been inadequate, determine client's tolerance to diet. Third is monitor client's fluid and food intake, and fourth is observe client's ability to feed themselves. And lastly is we need to document the procedure as done and results of the evaluation. That's all. Thank you.
I just had to let you know you're